Hi, everyone. Welcome to First Responders Sleep Recovery's Train the Trainer. We have an online session today with Tina Matarollo, an orofacial myofunctional therapist based out of San Diego. She is a firefighter wife and mother of 2 children, and her partner recently retired from North County Fire Department in San Diego. So welcome, Tina, and we're so happy to have you with us.
Thank you, Jacqueline. I'm super excited to be here. I'm a little bummed that I'm not going to be live and I won't be able to answer questions from the group, but I'm happy to be here and to share the information. This slideshow is going to be a little focused on the fire service, but I think it will relate to other fields such as law enforcement. All right, let's get started. So the presentation is termed Breathing and Sleep Dysfunction in the Fire Service. Let's talk a little bit about me. As Jacqueline said, my name is Tina Matarollo. I've been an orofacial myofunctional therapist for about 6 years now. My background is in dental, so I was a dental hygienist for many years. And I used to clean probably half of the fire department's teeth at my husband's fire department. And I'm certified through the AOMT, which is the Academy of Orofacial Myofunctional Therapy, and I am also a fire wife. Currently, I practice in Escondido, California, which is North San Diego, but I do see patients all over the United States and even in other countries. So I just wanted to mention a little bit about my fire wife journey, since the majority of participants are in the fire service. When I first started dating my husband, I was 17 years old, and shortly thereafter, he became a volunteer. Then he was picked up with the U.S. Forest Service, and he did seasonal work. By the time we got married, he was a hotshot for Vista Gran, and he did several seasons working with that hotshot group. Then he decided medic school was the way to go, so I worked while he went to paramedic school, and he was a paramedic in LA County for a little while he was looking for a full-time position. He was picked up with North County Fire, where he has worked for the past 25 years, and starting as a fire medic and then an engineer and most recently a captain. So it's always interesting when people ask me what I do, right? So when we're when we're out and about and we're in different settings, and you're meeting new people, people often say, oh, they ask my husband, what do you do? And he says, oh, I'm a firefighter or I'm a fire captain. And generally people really know what that is, and it's easy and people can relate to it. So when people ask me and I say I'm an orofacial myofunctional therapist, they often look at me like I have 3 heads. So it's not something that a lot of people are familiar with. So I think some of the information today will probably be new for the majority of people listening. So I kind of like to break down the term. So if we think of orofacial myofunctional therapy, so oro is really focused on the mouth, and then facial is relating to the face, and then myo is muscles. And it's really about the way that muscles function, or in reality, how their dysfunction of the muscles of the oral complex can create negative symptoms that can impact our health and wellness. So as an OMT, an orofacial myofunctional therapist, I focus on really basic life functions, swallowing, chewing, sleeping, resting, and breathing. And these are all things that we don't often spend a lot of time thinking about, but they have a great impact on our health and wellness. So let's talk about the different types of disorders that I address in my practice. So mild to moderate obstructive sleep apnea. Okay, so sleep apnea is a big and important thing that we focus on. There have been recent studies showing that myofunctional therapy does help to improve both mild and moderate sleep apnea. So that's been exciting to see in the research and the scientific literature. There's a lot more research around sleep in general right now, and a lot more research showing the importance of good restorative sleep. And that's really when our body heals itself. And so if we're missing that component of, those important deep sleep cycles, then we're not healing appropriately. Breathing disorders, we focus a lot on diaphragmatic breathing. So hopefully the yoga instructors in the group will appreciate that. Mouth breathing specifically is something I focus a lot on, and we will talk more about why we should not be mouth breathing in the next coming slides. Clenching and grinding. So clenching is generally referred to as tooth-to-tooth contact, mainly in the posterior or the back teeth. during the daytime. And some people are in this position for the majority of their daytime functioning. And clenching, anytime we have tooth to tooth contact, specifically on the posterior or the back teeth, it puts us into what's considered a sympathetic fight or flight tone. So, probably many people in the audience have some information about the autonomic nervous system, right? So, we've got two parts of the autonomic nervous system. Both are very important for survival and for life. So, we've got our sympathetic, which is our fight or flight, and we have our rest and digest, which is our parasympathetic. So, I work a lot towards shifting people to a more parasympathetic tone through breath work and positioning of our tongue and our teeth and our mouth. We don't have tigers really chasing us, around the block or anything these days, but there are so many demands as far as, culturally, technology, right? People are expect us to respond to them quickly. So a lot of us are living too much in this sympathetic tone. So a lot of what I do is really try to get us to a more relaxed state. Because when we're sympathetic, it can relate to things like anxiety and a low threshold. Things that shouldn't bother us normally can kind of easily push us over the edge. So I think that that's a really important part of my practice. Okay, tongue dysfunction. I see a lot of patients who have limited what we call range of motion of their tongue. The tongue is pretty amazing. I would say the majority of professionals these days would consider it an organ unto itself. So we're talking about a muscle, well, really eight muscles, in reality, 16. So eight pairs of muscles in the tongue. And when they're working appropriately, they can support our breath, our swallow, and important functions that we do. But when the muscles are not working appropriately, then other muscles have to come into place to make those functions happen. So a lot of people use their lips to help them swallow or their necks to help them swallow. And if we think about the fact that we swallow over 1,000 times a day, if we're using those what are considered compensatory muscles all day long, muscles that weren't meant for that function, then those get over fatigued. And then that can create symptoms such as, TMJ discomfort, um, head and neck pain, headaches, migraines. So I work a lot on not only strength and toning muscles, but relaxing muscles that aren't meant for certain functions. Habit elimination, I see a lot of kids. I mean, I see adults and kids, but habit elimination for kids is more things like thumb sucking, finger sucking, clothing sucking, chewing on objects, often like pens or pencils. These are all what are considered oral fixation or oral dysfunction habits. And so there's a reason why these things are happening. So as a myofunctional therapist, what I do is really focus on cause instead of treating symptoms, excuse me. So for habits, the brain is actually seeking a connection of the tongue to the palate. So they've done interesting studies where they'll map the brain when the tongue is low, and there's certain parts of the brain that are dark. And then when the tongue is resting against the roof of the mouth, that all of a sudden there's parts of the brain that light up. So it's pretty fascinating. And so when the tongue is not in its appropriate location, which should be resting against the roof of the mouth, then we end up with the sensory desire to fulfill this, brain need. And so for a lot of kids, that relates to thumbs, fingers, chewing, on objects and whatnot. And as adults, these things can really manifest more towards smoking, chewing tobacco habits, and whatnot. So they're all actually related in this realm of oral dysfunction. TMD, so that's a big issue these days. I would say that it's more heavily weighted toward females, but males too. But a lot of people end up with pain in their joints, in their jaw joints, which can be, very life limiting for some people. And again, that can radiate towards the head, the neck, and related to migraines, headaches, neck pain, shoulder pain, back pain. So a lot of what I do really encompasses a variety of, different areas of the body. So there's a lot that's going on in the head and neck that actually refer pain or cause more symptoms other places. Enlarged tonsils and adenoids. So this is an interesting topic because, oftentimes kids are having difficulty breathing or even adults. So the tonsils and the adenoids are both important structures in the body. I really believe that we are not born with extra parts, right? So they're not easily just dispensable. Obviously, we can live without our tonsils and adenoids, but the question for me is why are they inflamed or enlarged? If you send the child or yourself to the ENT and they recommend removal of these tissues, but removing them doesn't address the cause. So oftentimes, even though you remove them, people still end up with negative symptoms. The other question today is as we start to learn about the fact that our jaws are physically shrinking, and as our jaws are shrinking, our airway spaces are shrinking. Are the tonsils and the adenoids in reality too big, or are the structures housing them too small? Right? So it's an interesting thing to think about. Because if you took a small room and you put a bunch of big furniture in it, it would be very hard to navigate through that room. But if you took the same big furniture and put it in a large room, then it'd be much easier to navigate around. And so think about as the airflow coming into the body. So that's a big question today, too. Are the tonsils and the adenoids big, or is the space too small? Craniofacial growth and development is something I like to focus on. Obviously, we're a little limited as adults. You can expand the upper jaw as an adult, but it's a lot more of a complex procedure. And so I really try to focus on craniofacial growth of children at a very young age so that we can go in and really change the trajectory of their health and the way that they sleep and the way that they breathe. So that's a big passion of mine for young kids. So I'm sure a lot of our participants have children. So if you notice, you have a young child and you say, "Oh, look at their teeth are so beautiful and they're all touching and straight." Well, if the teeth are touching, we already know that they're deficient in craniofacial growth, right? Because those baby teeth are the primary holders of the adult teeth, the permanent teeth that will be coming in later. And there should be lots of space between the baby teeth. So it's really easy to tell even at a young age if there's deficiency in growth. All right, let's talk about the way that we should breathe. So breath should always come through the nose, in through the nose, out through the nose. I'm not sure if all the yoga instructors would agree with that, but in the world of myofunctional therapy and airway health, all the breath comes in and out through the nose. And so then we have to say, why is nasal breathing important? Right? So the nose, it prepares the air before it comes into the lungs. So it warms the air, it humidifies the air, and the most important thing I think is it filters the air that we breathe. So when the breath is coming through the mouth, we are bypassing this very complex filtration system of the nasal cavity. I have a couple favorite sayings, but one of them is that you should breathe through your mouth as often as you eat with your nose. And I love this saying because I think it really brings home the fact that they have very different functions. So it's important to remember that your nose is for breathing and your mouth is for eating and talking. So let's talk about mouth breathing and why it is not appropriate for us. So when we breathe through our mouth, like I mentioned previously, we are not filtering the air that we breathe. And this makes us a lot more susceptible to allergens in our environment. So if you think about things like seasonal allergies or hay fever, even allergies like from dogs or cats, animals, we're more susceptible to being hypersensitive to those things if we're breathing through our mouth. And this could be either daytime or nighttime. So I have a lot of patients who mouth breathe all the time. And I have some patients who generally nasal breathe during the day, but the mouth opens at night. And there are reasons why that's happening. And it's usually related to a low resting tongue position. The other problem is we do not oxygenate the body appropriately when the air comes through the mouth because we give off too much CO2. So CO2 is the delivery system of oxygen in the body. And this is especially important with the developing brain. So of course it's important for adults to properly, oxygenate themselves, but for children, any type of lapse in breath and lower reduction in oxygen upon a growing brain is something that's, serious and something that we need to focus on. And again, this talks about our constant state of sympathetic tone. So as we mouth breathe constantly, we're in this sympathetic tone, and we really want to change the breath to the nose and make sure that all breath is coming through the nose. And it's interesting because you can always, there's like these days you find people really training themselves to nasal breathe all the time. I mean, there's people that are running marathons that with their mouths taped because what they're learning is that we actually, as we oxygenate the body better through the nose, that we can perform better. So that's pretty interesting, but it's definitely something you have to work towards, at least for doing a marathon. All right, let's talk about nasal breathing, mouth breathing, and development. So, this is an interesting photo, and a lot of people never think about the way that they breathe, how it can affect the way our oral complex develops. So, if we look at the top guy here, he is a nasal breather. They generally have straighter teeth and a wider face, more developed jaw structure and cheekbones, alert eyes, and often a more straight nose. And if we notice, probably one of the more important parts is the good size of the airway. So if we look below, often this face is referred to as the adenoid face because many times when the adenoids are enlarged and it prevents proper oxygenation of the body, then we end up with this long face. So what happens is when we mouth breathe, our tongue is low in the mouth and our cheeks push in, and then we end up getting a vertical growth of the palate. And so it changes the actual structure of the face just based on the positioning of the tongue during development and where it's resting and where it is when we swallow. So if we think of the tongue as the scaffolding to the upper arch, every time we swallow during development, the tongue should be pressing against the palate. And it's this pressure against the palate that stimulates the palate to grow bigger. And our mandible, which is our lower jaw, is dictated by the size of the upper jaw. So if our upper jaw is deficient, our mandible is deficient, and we'll get this like retrognathic presentation where the chin is back. So it's pretty interesting to think that the way we breathe really affects the way that our whole facial complex develops. Let's see. Okay, so basically this was related to firemen, but of course law enforcement I think is very similar. So why is it important to address, these dysfunctions? Well, whether you're in the fire service or in law enforcement, you have a stressful job, right? You've already picked a job that's stressful. Shift work, you're working crazy hours when most people are sleeping, trying to possibly, get back up on your sleep when you're home. PTSD is a big one, and we'll talk more about that later. Lack of restorative sleep. Like I've mentioned, if we are not getting into the proper sleep cycles, our bodies cannot heal during rest. And then lack of breathing and sleep disorder screening. So this is what I'm becoming more passionate about is how can we find people in these jobs who are suffering or don't even actually know that they have a breathing or a sleep dysfunction, and how do we find them avenues to get them help? All right, let's talk a little bit about the thing. Oh, there we go. Let's talk a little bit about the signs and symptoms of sleep disordered breathing or sleep apnea. And then as I go through this list, maybe you can think to yourself, are these things that relate to me or, maybe family members, people you care about? So the first one I started there with is open mouth posture. Again, when our mouth is open, our tongue is low. So our tongue is not resting in the proper place in the mouth where it is supposed to be. This facilitates mouth breathing. If our tongue is low, our lips generally are going to open and we're going to mouth breathe. Audible breathing is interesting because a lot of people don't, again, think about the way that they're breathing or the way their spouse is breathing, but breath should be silent. Okay, so whether you walk into your room and your spouse is sleeping or you walk into your child's room, if you can hear the breath, that means there is some type of destruction or disputing, some type of issue between how the breath is coming into the body. So next is snoring. We'll talk a little bit more about snoring in a couple slides. But even audible breathing is a reason to be concerned. Some people sleep with their neck extended. Again, this would be trying to open up the airway during sleep or their arms above their head. Many of us have, exercised to the point where we're, having a hard time breathing. And when we notice that when we put our arms up that we can breathe a little bit better. So that is a sign of some type of breath or sleep dysfunction. Disruptions in brain function, memory loss, trouble concentrating. Again, these are all affected by um, dysfunction in sleep and breathing. Mood changes. This is a big one, right? In the fire service, depression or anxiety symptoms. So anything that we can do to help reduce those symptoms that are often associated with sleep and breathing disorders, I think is important. Sleep apnea, of course, is huge. So that's actually, lapse of, actual apneic episodes during sleep where breath is halted and the brain has to kick in to wake you up to start you breathing again. Tossing and turning is interesting because, we should stay pretty stagnant in our sleeping position. So if you, either your spouse or yourself or your children, if you wake up and your covers are a mess or your feet are at the wrong end of the bed, then obviously that is not good restorative sleep. Clenching and grinding, we kind of talked about. So clenching is, again, putting us into the sympathetic tone. When the tongue is in the correct position and we're nasal breathing and our lips are together, the back teeth should slightly fall apart. We call this a freeway space. It's, millimeters, but they should not be clenching. And grinding, again, of course, is a strong indicator of a sleep or breathing disorder. Waking up through the night, including going to the restroom. So during normal, good restorative sleep, we should go to bed and wake up in the morning. We shouldn't be having a lot of wake ups through the night. Obviously, this is difficult for people in the fire service or law enforcement who are working strange hours or woken up in the middle of the night to, attend calls and whatnot. Nightmares, night terrors can also be associated with a sleep disorder. Bedwetting is interesting. I don't think too many in this group are experiencing issues with bedwetting, but I like to include it because I'm assuming many of you are parents. And bedwetting past a normal, age of maybe 4 or 5 is concerning. So bedwetting can be associated with a sleep disorder. There's different, opinions on why that is, but one opinion is that as the body wakes itself up during an apneic episode, as it relaxes again, it gives off a relaxation hormone that releases the bladder. I just recently this month had 2 teenagers that quit wetting the bed, which was, a very big happy accomplishment for me, because for some, for kids that are older, this is life changing. I almost had tears in my eyes with my guy that I saw last week, because he's 15 and he doesn't go to camp and he doesn't go spend the night at his grandparents. So for him, not wetting the bed now was definitely life altering in a good way. Sexual dysfunction can be an issue, headaches, especially upon awakening. So if you're waking up consistently with headaches in the morning, that can be indicative of a breathing or a sleep disorder. Daytime sleepiness, again, this is difficult with shift work, because are you asleep, do you have sleepiness because you were up all night or because you didn't sleep well? Insomnia. Hyperactivity and ADHD is really interesting. There's a lot more research showing that the symptoms are very similar to sleep disorders. So what I feel like, medicine should move towards is really eliminating the possibility of a sleep disorder before ever medicating, especially children. So are they truly ADHD diagnosed, or do they have a sleep disorder that's mimicking the same symptoms? So that's pretty much new research that's pointing in that direction. Sensory issues, I think about this a lot with kids who don't, they don't like tags on their clothing, or they're very sensitive to textures in what they're eating. So sensory issues can be directly related to breathing and sleep dysfunction. And then venous pooling, meaning dark circles under the eyes, can be a sign. All right, let's talk about snoring, because why is snoring a concern? Well, because breath should be silent. As we talked about, even audible breathing is not appropriate or healthy. I think in today's society, we've really normalized snoring. Everything from, TV shows to Disney princesses that are sleeping with their mouth open and drooling, which is quite interesting. So, but just because something is common does not mean it's normal, and does not mean it's healthy. And one of the main reasons why snoring is such a concern is because it really can be an indicator of a much more serious breathing or sleep disorder, such as obstructive sleep apnea. So, you know, snoring isn't just annoying or not a big deal. Snoring is a reason to be concerned. And any type of disruption, again, in our breathing during sleep is going to prevent us from getting into the appropriate sleep cycles, whether that's REM or deep sleep for body repair. So, what causes snoring? So, there's a lot of different reasons that people snore. And one of the big ones is, like I talked about, is a low resting tongue position. So, when the tongue falls into the airway, then that can create problems. So, the tongue is the biggest obstructor of the airway during sleep. Mouth breathing, which we've talked about. So, again, mouth breathing, the tongue is low, so the tongue can often fall into the airway. Blocked nasal passages, allergies, sinus infections, deviated septums. These are all things that can make nasal breathing difficult. And so, with my patients, I always first put them on a very detailed nasal clearing protocol. To first, we got to see, is it possible to breathe through the nose? Like many functions of the body, when we don't use them appropriately, we lose them. So the more we mouth breathe, the more congestion. The more congestion, the more we have to mouth breathe. So it becomes like this cycle that isn't always easy to get out of. Decreased tone of the throat and tongue muscles. So I work a lot on strengthening and coordinating the muscles of the airway and the tongue. Significant throat issues. So that could be linked to extra weight in the throat or large tonsils. We talked a little bit about tonsils and adenoids. So tonsils as an adult that are large is a big red flag. So tonsils are important during development. They are the first line of defense in the immune system for children. But as we age, say generally around maybe 18 to 20, the tonsils should mainly dissipate. You shouldn't see much of any tonsillar tissue. So if you have enlarged tonsils as an adult, then that is a concerning symptom. Alcohol and drug use, obviously anything that's going to relax the muscles more. The muscles are already quite relaxed while we're sleeping. So anything that's going to increase that is going to cause more snoring. And then sleep deprivation, right? If we're super tired, sometimes we're too relaxed, and the snoring can be more pronounced. Okay, again, it was focused a little bit on fires, the fire department. So excuse my survey, but I think this survey is interesting because it's wives in general. Like they are fire wives, but these are wives. I thought it was interesting when I started getting more involved in airway health and talking to my husband about how other people at the fire department were sleeping. So he still, at his department, has several stations that are still communal sleeping areas. So we know if there's one or two firefighters that aren't sleeping well, that's going to affect the way the other firemen are sleeping around you, right? Whether they're getting up to use the restroom or they're snoring, or, he's had incidences as a captain where he's had firefighters that can't even sleep in the bed because they have to sleep in the recliner because they lose airway sleeping flat in a supine position. So I became more interested, and I thought, well, you can't really ask people how they sleep because people don't know what they're doing when they're sleeping. So I thought, let's ask the spouses. So luckily, I have a lot of access to other firewives since I'm in multiple groups with them. So currently, I have almost 640 responses, and I think it was about 25 questions. Obviously, I'm not going to get into all of them today, but I thought some of them were important to share. So let's see, this first question here is, does your husband sleep well when he is home from the fire station? So we've got almost 50% of wives saying no, their husband does not sleep well when they're home, which I thought was a pretty big number. And then the next question, are you concerned about your husband's quality of sleep? So about 70% of the wives that I surveyed are concerned about their husband's sleep quality. Does your husband snore? So we talked quite a bit about snoring. So if we look at our graph here, about 90% of wives said that their husband either snores often or sometimes. So that is a big indicator of a huge piece of the puzzle that we're missing here, right? Because snoring is nothing to be ignored. And then, does your husband have temporary lapse in breathing during sleep, often accompanied by loud snoring, choking, or gasping, which this is sleep apnea. This is absence of breath during sleep. And so 41% of the firewives said that yes, their husband has these times when they're not breathing at night. And 15% said maybe. So those are definitely things to be concerned about. Has your husband's fire department ever conducted an educational class on how sleep disturbances or disorders and sleep apnea negatively affect health? So again, these are the wives, so that might have been a better question for the husbands or spouses. But when we look at this graph, only 3% of wives are aware that there's been any type of sleep training or information or education on breathing or sleep disorders in the fire service. And I can probably attest to the fact that my husband's department has not ever chose to focus on that topic. Do you think your husband may have a sleep disorder? Now, this is an interesting question because we have 62% of wives suspect that their spouses have a sleep disorder. And then we look at this slide, has your husband been diagnosed with a sleep disorder? So less than 17% have been diagnosed, even though 63% of wives are concerned about it and think that it's a possibility. So this is definitely something that I feel is being undervalued in the fire service in general, and I would assume that law enforcement is likely similar. Do you think if your firefighter husband had better quality of sleep both at home and at the fire station, he would be more engaged with you and your family and overall more mentally and physically healthy? I mean, this answer to me is why I'm here today, really. I mean, 70%, 76% of wives definitely confirm that they think if their husband slept better, that they'd be more engaged with their family and probably more patient and less grumpy and more mentally and physically healthy. All right, let's talk about a little bit about why our functional airway spaces are getting smaller. I kind of mentioned that our jaws are physically shrinking. So if we look at archaeological studies over the last several generations, the jaws are definitely smaller. And as our jaws are shrinking, our functional airway space is shrinking. So think about your airway as just a space, right? Surrounded by structures. And as those structures are getting smaller, so is our airway space. I mean, I would definitely say that we have an epidemic of especially young adults and kids with sleep apnea. I have 22-year-olds coming to see me on CPAP machines, and it's pretty concerning, really. And then when we talked about how lapse in breathing can really affect the developing brain, those are, implications that are going to affect them likely for the rest of their life. So part of it is our change in diet, and this really started around the Industrial Revolution. Diets became a lot more soft. There were a lot more processed foods. Today, kids, often have diets of, mac and cheese and chicken nuggets and whatnot. And a lot of us are living these fast-paced lives, and sometimes these foods are easier. And, I truly believe the food industry makes them taste really good, so the kids want more of them. But really, chewing on the back molars, even before teeth, chewing on the area where the back molars will be one day is what stimulates growth of the jaws. So, as our diets have become softer, our jaws have been smaller. If you think back, I like to think back maybe what did your great grandparents eat, right? Nobody was pureeing baby food. Like that just wasn't part of the deal. And unfortunately, parents are so, programmed to be afraid of choking that they give their kids really, really soft diets for a long time. The next one is lack of breastfeeding and really more specifically long term breastfeeding. So, a lot of people talk about the importance of breast milk, which I am a huge component of or advocate for, but we don't talk a lot about the physicality of breastfeeding and how it really develops the structures of the oral complex for more sophisticated needs and functions, such as chewing, more aggressive adult food and speech. Speech is a big one. I see a lot of kids with speech dysfunction. And I do not treat speech, but what I do often improves speech. So that's really interesting. The other thing is lack of diagnosis and treatment of tongue ties or basic tongue dysfunction. So again, if we think back about our, a couple hundred years ago, if babies didn't breastfeed, they died, right? So to me, breastfeeding is a vital sign. And if a baby is not able to breastfeed, what do we do today? We put them on a bottle, which is great that we have more children that are surviving, of course. But again, if we're not addressing the underlying dysfunction of why this baby was not able to breastfeed, we will likely have, more concerning symptoms as the child gets older. So lack of diagnosis and treatment of tongue dysfunction and disorders is a big one. Retractive orthodontics. So, orthodontics is a little bit of a touchy subject in airway because, as orthodontists, they either can help the functional airway space or inhibit it. And so, unfortunately, currently in the orthodontic residency, airway health is not focused on, which sounds crazy to me when I think about how much influence they have over the functional airway space. So oftentimes, though, you can find what are considered airway-centric orthodontic, offices where that orthodontist has specifically chosen to educate themselves on airway health and bring it into their practice. So I would encourage anyone with young children to find an airway-focused orthodontic care for their children if that's something that they're looking into. I think a lot of us can remember either family members or friends who had orthodontics, years ago, and they would often pull, what are considered the bicuspids, the mini molars here, So oftentimes what was typical is they would pull the four bicuspids, and then to close those spaces, they often would pull the teeth back. So as we're pulling the teeth back, we're shrinking that functional airway space again. So luckily, I think most orthodontists are aware that pulling teeth is not the solution. The issue is when we have crowded teeth, it's not because the teeth are too big, it's because the jaws are too small. So if we can intervene at a young age and help get the growth that these children need, then it allows the adult teeth to come in the way that they should. And not saying that you can always avoid orthodontics, but if the jaws are grown to the appropriate size, often, orthodontics is either not needed or would be a much shorter time that the child would be in, say, braces or Invisalign, whatever choice you end up making. The other thing I'm just going to touch on a little bit about orthodontics is the other big piece that I feel that they're missing is if you don't address the underlying muscle dysfunction that created the need for braces, then the teeth are going to continue to move. So just as orthodontists use wires and brackets as pressure to move teeth, the tongue will move the teeth. So say you have a patient that has what's considered an incorrect swallow or a tongue thrust swallow, and their tongue is pushing against their teeth all the time. We talked about we swallow about 1,000 times a day. That will move the teeth. So if you've ever heard of the term or thought about what the term is called orthodontic relapse, how many adults do you know that had braces when they were teenagers and the teeth moved and now they're adults and they're in Invisalign and they're doing the whole thing all over again? Well, if you don't address the underlying muscle dysfunction, you are going to have movement of the teeth, which is why most orthodontists these days say wear your retainers the rest of your life because, again, they're not addressing the muscle dysfunction. So I'm pretty passionate about orthodontic relapse, making sure that our teeth stay in place once they have been corrected. And then changes in our minerals, in our food supply, right? I think a lot of us know that our food supply, the soil specifically, is deficient in minerals. The 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 soil is overworked. We're not giving it enough time before, more things are being planted. So there is some research showing that lack of proper minerals are also influencing the growth of the jaws. All right, I'm just going to touch a little bit on some of the basic types of breathing and sleep dysfunction. So we kind of talked about obstructive sleep apnea, also called OSA. And this is when there's lapse of breath due to some type of obstruction. So usually it's the tongue, but it can also be the soft palate. There's different parts of the oral complex that can relax too much and impede the airway. Central sleep apnea, wow, that's a beast unto itself. So central is a little bit more difficult because it's actually happening when the brain is not sending the correct signals to the muscles to control breathing. And so that's a little bit of a different animal than OSA. But there is some research showing that central sleep apnea is correlated to mouth breathing. So that's interesting. And we'll see how much, how the research evolves from here. Obstructive sleep disordered breathing, SDB. So this is interesting because it's not actually lapse in breath, but it is dysfunction in the upper airway. And then we end up with what's considered upper airway resistance syndrome or pharyngeal collapse. So it's not completely cutting off the airway, but it's impeding the breath enough that it's affecting the way that we sleep. So I just want to talk a little bit about the severity of different types of sleep apnea. So again, we've got 3 different levels here. Mild sleep apnea is at the top. And I think this is interesting because it's considered mild to stop breathing 5 to 15 times per hour while you're sleeping. So to me, I don't know if mild is quite the right term for that. I don't know if I'd agree with that, but that is how things are calculated currently. And again, as I mentioned, even one of these events for a child during sleep is considered severe. So for adults, mild is 5 to 15. For moderate sleep apnea, we jump up from 15 to 39 episodes per hour. And these, of course, are monitored by sleep studies, either inpatient or take-home studies that some providers are using. And then severe sleep apnea is more than 30 events per hour that you were not breathing during the night. So I think I talked about the fact that as a myofunctional therapist, I really focus on the first two. For severe sleep apnea, I definitely would, that would be a referral out to a sleep specialist. So I'm only one piece of the puzzle, right? I work with a lot of different providers in my area and outside, from orthodontists to dentists to ENTs. So to fascia workers to cranial sacral therapy. So we have quite a range of different providers because most of my patients need more than me. So I like to think I'm a large part of the solution, but they often need others to help um, really gain that overall, completion of good health and wellness for themselves. Okay, so let's talk about, I can move my slide here, different treatments for sleep apnea. Now, of course, I put the top myofunctional therapy because that's what I do. But if you notice as we go through the rest of these, myofunctional therapy is the least invasive. Okay, I like to compare myofunctional therapy to physical therapy for the mouth and the airway. So I definitely work on strength and coordination and function, and then I usually often have to address the swallow, liquid swallows, food swallows, and it's really about the way that we, chew, swallow, breathe, sleep, and breathe. So as we go through the list here, a lot of people are familiar with CPAP machines. So this continuous positive airway pressure devices, wearing a mask at night. There's different, we could go into a bunch of different types, but BiPAP is another similar mask. But CPAP, my two biggest concerns about CPAP machines are that one is patient compliance. So a lot of people don't like wearing the device. And so they'll wear it sometimes and feel better, and then they'll kind of get off track. And then, or say they go on vacation and they don't want to bring their CPAP machine, or, even with the fire service, what if the guys don't want to wear their CPAP at the fire department? So there's different, issues with compliance often. And then my other concern is that this positive pressure system actually weakens the muscles of the airway. So as we continue to use the CPAP, we lose muscle strength in the airway. And so if we do have a time when we decide we don't want to use it, we're actually putting ourselves at risk because the airway muscles are no longer as toned as they were before using the device. But, for some people, it's a good option, right? They sleep better and they start to feel better. And so they feel like, okay, I'm going to make sure I'm doing this all the time. Then we have oral appliances such as a mandibular advanced splints. And again, for some people, this is enough to provide better sleep. There's still a lot of information we don't know about advancing the mandible and what kind of damage or pressure we're doing to the joints to have the mandible or the lower jaw in that position all night. So again, none of these are perfect, right? Tissue removal or shrinkage. I see some patients who they've had their uvula excised, their adenoids, tonsils. Again, I think myofunctional therapy seems like a much easier way to go about things, but I'm sure I'm a little bit biased. Nasal surgeries. We talked a little bit about deviated septums and how vertical growth of the palate applies pressure to the septum and will deviate it often. Sinus surgery, reduction in turbinates. There's a variety of different, things that ENTs can do to help with nasal breathing. And then nerve stimulation surgery. So this one's interesting, where they actually implant devices that arouse you if you start to have reduction in oxygenation during sleep. All right, let's talk about the concerns associated with sleep apnea specifically. And again, I kind of focus this towards firefighters, but I'm sure law enforcement is very similar. So if we look at the list to the right, high blood pressure, type 2 diabetes, strokes, heart attacks, and a shortened lifespan. As the firefighters already know, they're already at risk for high blood pressure, type 2 diabetes, strokes, heart attack, and shortened lifespan. So when we compound that with sleep apnea, we're just increasing the risk of all these concerning health disorders. All right, what's some natural or easy ways that we can decrease our risk of obstructive sleep apnea? So I did put weight loss on here because I do think it's relevant. But back in the day, I would say more people thought like, oh, the people who have sleep apnea are overweight males that are older. And really, that's not the presentation that I'm seeing anymore. I think that that might have been true, several decades ago. But like I mentioned, I mean, I see children every day that are not breathing at night, and I see young adults, and it's honestly quite terrifying to, so weight can be an issue. If you have excess weight around the neck or the oral complex, the tongue does gain space with addition to fat in the body. So sometimes that can increase the size of the tongue and become more of an issue. Avoiding alcohol, caffeine, and certain medications. Again, we kind of hit on that. Anything that's going to relax the muscles more can affect the way that the tongue or different structures of the oral complex could be impeding the airway space. Smoking is interesting because there are studies showing that if you smoke that you have an increased risk of obstructive sleep apnea, but it's not exactly clear what the association is between the two. So I think most of us know that smoking is not a healthy habit. So there are many reasons to quit smoking, but a reduction in OSA is another one. And then regular exercise. So it's just, studies have found that it reduces our disrupted breathing events if we exercise regularly. And I'm sure, similar to my husband, that most of the fire departments have facilities where, the firefighters can work out, and that a lot of fire departments, are making that a priority. So that is helpful. Okay, I did put some stuff on sleep hygiene here. How are we doing on time? Do we have time to go over sleep hygiene? Yes. Okay. Thank you, Jacqueline. And a lot of these things will probably be talked about by other speakers. And so, but I think it's always good to hear information more than once. So a sleep routine can be important, making sure that you're going to sleep and waking up similar times during the day. Here it says 8 hours of sleep is ideal. I actually read recently that women actually require a little bit more due to hormonal issues. And so women, I would actually bump that more closer to 9. Falling asleep, what is your routine? I like to read before I go to sleep. So whatever kind of relaxes you. I think most of us know that we need to unplug a lot before, sooner before going to bed. So, it's important. They usually say within, 30 minutes to an hour, it'd be best not to be on electronic devices. Dimming the lights. Jacqueline, I think you guys focus a lot on this, right? Red light therapy and whatnot, really helping to protect our rhythms of sleep. Relaxation, anything that helps to turn off the mind, whether that's meditation or prayer or whatever works for you. And again, we kind of hit on physical activity and how exercise improves sleep. A wake up schedule, try to be consistent even on the weekends. Sometimes that's hard. Prioritize sleep. And, sometimes even I'm guilty of this. I feel like there's not enough hours in the day, but we really need to prioritize sleep. And likely most of us need to go to bed a little earlier than we currently are. Gradual adjustments, in sleep time. If you need to start adjusting your schedule, maybe you can do that gradually. Reduction in naps. Again, this is probably difficult, with the fire service, because when you haven't slept all night, your tendency is going to want to be to take a nap that day, but will that nap impede the sleep for the next, night? So it's something to be aware of. Winding down, routines. I think we're much better at this with our own kids, because most of us who have children, we have a whole routine when it comes to bedtime. But as adults, we're not always as good at doing that for ourselves. Avoiding smoking, we talked about reduction in alcohol, caffeine, avoiding eating late at night. It's interesting too. I see a lot of patients who suffer from GERD. And if you really can stop eating within, I would say, at least 4 hours of sleeping, that can really improve symptoms during sleep. So I think that that's a good one. Mattress and pillows, again, we go back to the fire service. I talked to my husband, they're basically given a standard mattress, and well, that doesn't really work for everybody, right? Some people want a more firm mattress. Some people want, something a little softer. So it'll be interesting as things progress in the fire service if there can be some more individualized, choices as far as bedding and pillows and mattresses. Cooler temperatures. I think a lot of us have heard that we sleep better under cooler temperatures at night, obviously blocking different sources of light so we're not, woke up earlier than when our body would like us to. Allergies, again, that goes back to nasal breathing, right? We want to filter the air before it comes into our sensitive lung tissues. Limiting TV, exposure before bed. Let's see, we talk about soft surfaces. White noise. I think a lot of people like to turn on fans or some type of white noise to give them less distraction while they're sleeping. calming scents. A lot of people like to use diffusers or humidifiers with some type of addition to them to bring calmness before sleep. We hit snoring a lot, warm showers, mental health, of course, is a big issue within the fire service, and I'm sure the police department too, law enforcement. Controlling pain, overthinking. Oh, this one's my husband right here. He's a really good overthinker. So finding ways to limit, to be able to turn our brains off is important. And a sleep diary might be beneficial. All right, how can we improve diagnosis and treatment of breathing and sleep dysfunction in the fire service? And who is responsible? So I think it would be really beneficial for us to have a questionnaire, right? So the majority of fire departments I know do give a physical every year to check health and wellness. And if we could do something as easy as provide a questionnaire that's based on sleep and breathing, I think that that could really help us to see any red flags and direct, these firefighters to services that could help with that. And then most fire departments these days that I'm aware of have some type of wellness program. And so if we could really incorporate more sleep education and breathing education into those wellness programs, I think that could benefit everyone. And I wish I could take credit for this, but I was talking to my husband about ways to improve diagnosis and treatment in the fire service. And he came up with the if you hear a snore, don't ignore. So that was thanks to my husband. And so it's important, right? If you hear somebody snore, it means that they are not breathing well and they are not sleeping well. So it's important to maybe gently, talk to them about what we've learned today. So, and then everyone needs to be a sleep advocate. Okay. If we sleep well, all our employees and the people we work with, it'll be a safer environment. They'll be more in tune to their cognitive abilities and reflexes. So I think it's important for everybody in the fire service to be sleeping well, either for your employees or for your family waiting for you at home. Okay, I wanted to touch a little bit on sleep disorders and post-traumatic stress. There's still a lot of research going on currently. It's kind of the chicken and the egg. We do know that people with post-traumatic stress tend to have higher rates of sleep disorders. So, did the sleep disorder exacerbate or make the post-traumatic stress worse, or did the stress end up creating a sleep disorder? So, there's still, again, a lot of dispute and discussion about that topic, but they do have very similar symptoms, everything from insomnia to hyperarousal, sleep disturbances, nightmares, right? We know that whether it's sleep disorders or post-traumatic stress, that there's more light sleep, less again of that deep restorative sleep that we talked about, and more fragmented REM sleep. And then obstructive sleep apnea, as I mentioned, they have a higher prevalence of this condition with people who do have PTSD symptoms. And I thought this was interesting because it talks about treating PTSD related sleep problems is an important part of resolving overall PTSD symptoms. So, really, if we're not addressing sleep, we're not going to get, maybe as much improvement over the PTSD symptoms if we ignore sleep. All right, well, here's just a little bit of research. There is a lot of different research that's been going on as far as myofunctional therapy. So we've got research about, treating obstructive sleep apnea. What is the role of the myofunctional therapist in sleep disordered breathing? And then again, obstructive sleep apnea focus on myofunctional therapy. That article is really focusing on how we as myofunctional therapists can greatly improve mild to moderate sleep apnea. And then I added my favorite little picture. This was years ago, but these are my two children in front of the fire engine. And this is really the reason I'm here and the reason I do what I do is because of this group that is my family. And I love this picture because my family's happy place is Southern Utah. And so I just think it's important for everybody to remember to sleep well, take that time together, and really appreciate the time we have because, as any parent knows, the time is quick. All right, that's all I have for you. So let me know if you have any questions, Jacqueline. And thank you so much for giving me the opportunity to share this information.
Thank you so much, Tina. This is such valuable information, and the work you do can be life-changing to those in the fire, police, and emergency services, paramedics, even shift workers across the board, from nurses to, everyone who is impacted by sleep loss due to their work could benefit from myofunctional therapy. So thank you for your service to the world, and tell your husband as well, thank you for his service. I will ensure that everyone has your contact information, and perhaps if we could compile some questions for you after everyone views this, as well as a couple questions that came up for me. Do you have a couple minutes to go into maybe
Sure.
just a couple questions?
Yes, for sure.
So when you were talking about mouth breathing, are you suggesting that we at all times should be breathing in and out the nostrils, and in certain techniques, it would be instructed to breathe in through the nose, out through the mouth? Are you suggesting that those techniques should be not utilized?
No, it's a great question. No, I think there are appropriate times, right? So even if we have, say, exercise where we're working out really hard and we have to open the mouth to breathe. So I think as long as we're maintaining nasal breathing the majority of the time, day and night, that there are those times when the mouth it can be open, right? We have to think that the mouth is a great backup breather and it's important we have it. But when we think about the way that the body is designed, babies are born obligate nasal breathers. That is the way that they are designed. And if a baby's tongue is healthy and functioning correctly, and you pull the chin of the baby's tongue down, the tongue should be suctioned to the roof of the mouth. So we are designed to be obligate nasal breathers. And so anytime we kind of go away from that way of the way the body is harmonious in its design, then we end up with issues. But no, I don't think if you're practicing, say, certain yoga, I mean, I was kind of joking with the yoga instructors, but I don't think if you're practicing those techniques as a form of relaxation and they're temporary, I don't think that that would be a concern.
I'm in agreement with you. I don't think that people should be doing breathing techniques in and out the mouth. I was just curious in the pattern of in the nose, out the mouth. There are a lot of different trending breath practices right now, of which specifically for first responders, because of that heightened sympathetic tone, I actually advise against, and that it's more important to regulate and come into that balance and self-regulated state. And in order to do that, we need to practice parasympathetic breath patterns. There was really only one technique that I've learned in terms of yogic practices that use the mouth, and it's only when the body is overheated, and it's a technique called Shitali breath, where it's to cool and you breathe in through the mouth with a potentially curled tongue like that, but it's not necessarily advised. It's only recommended in certain times, but yeah, we are definitely in agreement and in alignment with nostril breathing. That is absolutely ideal, especially with the filtration system that we have built in.
Well, what's interesting too is I like to say that the tongue is the rudder to the body. So when our tongue is lightly suctioned to the roof of the mouth, it improves posture, right? So if you're practicing yoga, having your tongue up actually improves, your practice. So I think it's important to think of it that way.
That's actually super fascinating, because some ancient techniques would actually advise pressing the tongue to the roof of the mouth for deeper concentration. So, and what is that? If we could affect our posture and our nervous system runs, through our spinal cord to our brain. I mean, it all makes sense. It's fascinating to me that the ancient yogis knew what was going on.
Definitely, definitely.
So another question I have for you is, have you seen or what did you witness in your husband's sleep patterns while he was in his career, and have you seen it shift since he has recently retired?
Yeah, I mean, that's a great question. And we're still very new to the retirement, life at this moment. So there is definitely some adjustment even for our family, right? And me
Mhm.
as a fire wife for many years, I've had to be very independent. So learning to actually let him do things and have the help has been a little bit of a challenge. But it's funny because when people see him now, especially other people from the fire department, they think he looks younger and like healthier than when he left. So I think it's really a testament of the fact that, being able to sleep every night and not having those constant wake ups, how it can really not only improve the way you feel, but the way that you're presented to the world. And, we've had just multiple people comment on that for him. So he's happy to be sleeping every night. And I think sometimes he's like, I can't believe I wasn't doing this for, 30 years or whatever. So yeah, it's been
Wow,
interesting
that's
to witness it
amazing.
myself. hmm Yeah.
Super, super amazing. And I think Sean's father, when he retired from the fire service, had similar compliments. And um, I just find it so fascinating when we can get our sleep right and our hormones back in balance, the benefits it has, specifically thinking melatonin, if you're disrupting your sleep with calls through the night and forcing that sympathetic response, creating that cortisol
Yep.
elevation and the melatonin being suppressed, and all the research that's coming out about healthy natural melatonin levels being long-term survival, and really kind of, I like to call it like the elixir of life, because it's now being shown to be even
Decrease risk of cancer.
anti-cancerous.
Yes. Yes. hmm
And I would imagine just anti-aging in effect. But that being said, also it's we don't necessarily recommend taking exogenous melatonin, with the exception of specific cases. However, there are natural ways to lower your sympathetic response that will boost your melatonin levels. But that's super cool that your husband has had that impact from being able to sleep more. And I'm sure it is kind of a process to readjust family life. It's a big thing when you marry into the fire service or in law enforcement, or if you have a partner in as a paramedic. It is truly a whole different lifestyle. You have shift work in a sense, because especially if you're raising a family, there's a lot that comes with that. So I find that to be super fascinating, and thank you for sharing your
Well,
personal
I have found
experience.
myself several times telling my husband recently, like, you were not at the fire station. They have a very set way on the way that things are done, and it's important because it keeps them functioning well, right, and organized. But sometimes I have to remind him that he is not at the fire station; he's at home.
Really funny. I've actually, sometimes when Sean is off shift, I have to remind him
Yep.
that as well. um, okay, any other final thoughts? Oh, I guess one final question I have is, if you know adults feel that they have a less developed jaw, is there any tip you can offer to create more space for airway flow?
Yeah, I mean it's difficult. I mean there are expansion appliances to again you have to first expand the upper jaw because the lower jaw follows the trajectory of the upper jaw. So there are different appliances from there's something called a DNA appliance which is made through Vivos, or there's an appliance that some people are using currently called Marpi, which is actually inserted, screwed into the palate to gain space. So there are these things that you can do, but again, it's much more difficult to do that as an adult. It's not impossible, right? It takes a lot of commitment because you're, often wearing an appliance, say 16 hours a day to create
Oh,
little, millimeters of expansion over time. And oftentimes that will start to create a lot of space between the teeth aesthetically. So all of a sudden you've got like a big old gap between your front teeth and you've got,
mm,
space. So most of those patients do end up having to do some type of orthodontic or Invisalign correction after. So it could be, say, a year and a half of wearing an expansion appliance, and then doing some type of orthodontic treatment after. So it's definitely not impossible, but it does take commitment And there is a, quite a large financial, part of that too. So, but for a
For
lot of
sure.
people, for people that can't breathe well all night long, they look for answers. And so there are people that are going that route. I mean, I do have adult patients that are in expansion appliances.
Right. And let's see, any final thoughts, shares about your own journey into this field, or any other um, words of
What I've
wisdom for
noticed,
our group?
yeah, what I've noticed is that most people that are in the airway, centric professions currently, it's usually because something has affected them, either themselves in their lives or somebody that they care about. So I first got interested in, the effects of how the tongue really functions when my oldest son, Cash, was born. And, he was born at 29 weeks and weighed like 2 pounds, 14 ounces. And so he was in
Wow.
the NICU for 41 days. And, I had a lot of difficulty nursing him. And I was pretty determined. I mean, I would consider myself somewhat of a stubborn person. So sometimes that can be beneficial or not. But I was having a lot of issues nursing him, even though we were in what's considered a breastfeeding culture in the hospital, like a hospital that really, helped with that. But I continued to have problems when he got home. And then I ended up finding a lactation specialist who I would call her the guru. She was old and crunchy and knew right away what was going on. And so he was born with a typical tongue restriction that was inhibiting his tongue to efficiently pull milk from the breast. And so we did go through a procedure with him where, they go in with either some type of scalpel or laser, and they actually cut the frenum tissue, which is attaching the tongue to the floor of the mouth. And I was able to go on. I mean, I breastfed him for years, and there's no way that that would have happened if I hadn't have found some help. And I think the biggest problem for, women these days is we're not surrounded by a bunch of other breastfeeding women, whether that's, sisters or moms or aunts or, we used to have this, this huge community that would kind of help and, give us advice. And so that's lacking, I think, today. And so that was kind of my first really interest into how the tongue functions. And then my younger son, right there on the right, that little cutie, when he was 5 years old, he was actually diagnosed with leukemia. And so, and that's the type of thing that kind of rocks your world for sure. And so, part of the reason I like to help with the fire service in general is because, we were surrounded by so much love and, care during his time. Oh, I get emotional. Yeah. But
Mhm.
not only for my husband's fire department, but surrounding fire departments, people we didn't even know or didn't know our family. And so when you end up with that type of situation, you really start to kind of reevaluate your life and what are you doing? And, at that point I had been a dental hygienist for, I think 15 years or so. And so I took off some time when Kai was in treatment. And so it really you start to evaluate, and I'm like, okay, am I going to go back and do what I was doing? Am I fulfilling enough for me? Am I helping my community enough? So I don't know if I would have really gotten pushed in this direction without his illness. So it's always interesting, these little silver linings that happen when we go through, really hard journeys in life. And so I just decided at that point that I was done doing dental hygiene and I was going to move into the airway kind of circle. And then I started taking courses, and I was fortunate enough to find a myofunctional therapist who had been doing it for, say, 15 years. And she basically took me into her practice and taught me everything she knew. And I still work for her today. So it's been a great
Amazing.
journey for sure. Yeah.
Wow, what an incredible family story, from um, the tongue tie to overcoming leukemia. And how's your family today?
I know I say it so casually only because it's been years, but yeah, everybody is great. He finished treatment let's see, maybe 4 years ago, and so he's considered cured at this point. 5 years past the end of treatment for him, and he is happy and healthy and loves life, and so things are good. Things are really good.
Great, great. And when was
Congrats.
that picture? When was that picture taken?
This was probably a year ago in Utah. Like I said, that's kind of our happy place. My kids love to dirt bike and motorcycle. I mean, dirt bikes and quads, and love the desert. So Everybody
Fun.
needs to get out and enjoy, part of, health and wellness is really being outside and enjoying your time together. So we try to make that happen.
Beautiful. I love it. Well, everyone there looks fantastic and happy in their happy place. And yeah, we absolutely agree. And that's part of the reason why we're doing this training partly online, is to front load some of this important content so that when we do the retreat in June, that we will have ample time for everyone to go outside in nature. Nature is so healing, and spend quality time as a community and enjoy the hot springs and go on hikes. And so, yeah, we're such advocates in agreement with that. Nature is so special, and I'm so glad you and your family get to have fun times doing those activities in Southern Utah. What a beautiful place.
Yes, it's gorgeous for sure. Well, thank you so
Well,
much. I really appreciate you asking me to speak today, and I hope the information is helpful. And yes, I'm open to answering questions that people might have, once the recording has been live. So, yeah, I'm here to answer whatever you guys need. I do practice in San Diego County specifically, but I do see a lot of patients online. So I have patients all over the world. I had a patient the other day in Rwanda. So it's
wow.
pretty interesting how the world of airway health is opening, and this ability to have this type of platform like we're working with today has, given more access to people. So that's been great.
Fantastic. And how can people contact you if they wish to?
Well, I think you're going to post everything right on a way to contact all the presenters. But if you go to my website, it's oralposture.com. And so that is an easy way to contact me. And yeah, I'm
Great,
open
Tina.
to whatever anybody needs. So, and I'm happy to help
Wonderful.
people improve their health and wellness. So thank you so much.
Excellent, Tina. Well, thank you so much for your time and expertise today. And I'm sure everyone really enjoyed this. And we will be plugging this into our online portals for people to review and offer a space for questions. And we'll get those to you and get everyone your information. And hopefully we can connect again for a future collaboration of some sort. So,
I would
thank
love
you.
that.